beautiful morning to every one of you and welcome to my channel. My name is Violet Okolocha. I actually talk about everything about Osce and nursing here in the UK. Before I proceed, I want to say a big congratulations to my fellow nurses who has passed their Osce exam. Too many messages, guys. I'm super proud of you. I celebrate with you and I like you to know I'm proud of you. So guys, it is very pertinent today for you to know that it is no longer a mannequin you use in your Osce exam. It is now a trained actor. And a lot of people have been like, please can you do a video to let us know how it feels? I'm very happy to do that video today, but I beg you, watch this video to the end. There are certain salient points I want you to take note of. As you're watching this video, take note of those salient points. A word they say is enough for the wise, and nurses are very, very wise people. So guys, assume my assessor has told me, assume you've checked for scene safety, assume you've provided privacy, now proceed to your patient. If that happens in your clinical exam, it is normal. Your assessor actually wants you to pass and she's trying to help you minimize time. All right, so just go straight to your hand hygiene, then you proceed to your patient. Is that all right? So now today I'm going to be doing as if my assessor has asked me that I've provided privacy for my patient and I've, then I can carry on. All right, so let's get started. So I'm going to be doing my hand hygiene, assuming I've provided privacy to my patient, palm to palm, right palm over left dorsum, vice versa, fingers interlaced, fingers interlocked, rotation of the form, tips to the finger, and the wrist. So my hands are clean, and now I can proceed to my patient. Hello. Hi. My name is Violet, and I'm one of the nurses looking after you. Can I know your full name, darling?
My name is Elizabeth.
Perfect. And your date of birth, sweetheart?
The 15th of February 1940.
Bless you. Haley, is that all right if I double check that with your wristband, my love?
Yeah, that's all right.
Oh, lovely. So I have here Haley Brooks, date of birth 15 February 1940, hospital number 101010. Assessor, with the paperwork on my hand, I can confirm I have the right patient. Haley, can I quickly ask you, do you have any allergies at all to food, drug, latex, or adhesive, my love?
Yeah, I'm allergic to strawberries.
Oh, bless you. So what happened when you take strawberry, darling?
I have swollen lips and
Oh my
over my body.
God, bless you. So that's why you're wearing a red wristband. Everyone on the team will aware you're allergic to strawberry and nobody's going to give you anything containing strawberry. Are you happy, my love?
Thank you.
So darling, the reason I'm here today is because I want to assess you, okay? Before I do that, what brought you to the hospital?
So for the past 2 weeks, I've been having difficulty in breathing.
Oh, bless you,
and I was
darling.
told that I have asthma, so I've come for my routine checkup.
Oh, bless you. So how are you feeling? Because I see you've been weaned off oxygen. You feel better, don't you?
Yeah, I feel a lot better with
That's
medications.
that's good. So I will just be assembling my equipment. If you are happy for me to do your assessment, that's your blood pressure and your pulse respiration. So if you are happy, I will just assemble my equipment. Is that all right?
That's fine.
Please wash your hand, put on your apron, and put on your glove before doing your what? Assessment. All right? So look what I do now. I pop in my hand sanitizer, palm to palm, right palm over left dorsum, vice versa, fingers interlaced, fingers interlocked, rotation of the form, tips to the finger, and the wrist. My hands are clean. I said, so please could you confirm my equipment has been clean and ready for use?
Yes.
Perfect. Put on your apron. Don't be scared, the exam is very simple. Haley, can I confirm with you that you've never had surgery on your left hand? Is that correct?
That's correct.
Perfect. Because I can see your left hand, darling. There is no inflammation. I'm happy to use your left hand, all right?
That's fine.
So in the clinical setting, you tie the automaton, you tie the cuff 2 to 3 centimeters away from the cubicle fossa. But I don't have that. I'm using the wristband. So verbalize, I'll be tying my cuff 2 to 3 centimeters here. I'm verbalizing it, you are doing it. You're actually tying it 2 to 3 centimeters away from the cubicle fossa. This is actually for the wrist. But I'm just going to be using it for this method. It's not going, so I'm going to use it on the wrist. So as you do this, put your probe on the first finger. Can I see your first finger, darling? All right, so I'll do a capillary refill. I see it's less than 2 seconds. I'm happy to put my probe. So put your probe, put this on. You'll feel some tightness, darling. Don't worry, as soon as it's out, that's all. All right?
Thank you. Yeah.
No worries, darling. Well done, you darling. It's red already. So your blood pressure is 131/87. That's quite good, darling. Bless you. So 131. Remember to write the patient's name, Ellie Brooke, 15 February 1940. Date of admission is 26th of 9th, 2021. And so the blood pressure now is 131/81. Go ahead and chart over 81. So I've charted the blood pressure. Remember to put your dates. Please, guys, put your dates. All right, so that's it. All right, Mrs. Ellie, thank you very much. Now, the automaton you'll be using in your exam will show you the pulse. Just like this, it's showing us our pulse is 83. But please don't take note of that pulse. You have to manually count the pulse for 1 minute. Manually count the pulse for 1 minute. All right, darling, I'll just take this off you. Is that all right, darling?
That's all right.
Thank you, darling. And I will take note of your SAT. Your SAT is 97. All right, so I record the SAT 97. Darling, I'm just going to count your pulse for 1 minute. Is that all right?
That's
I'm going to be putting 2 of my fingers on your radial artery, all right? Can I just take your watch a bit
Don't
off?
take it off?
Yeah, that's fine. Is that too much to
No,
ask?
that's all right.
Oh,
That's
bless
fine.
you. You're so sweet, darling. Thank you so much. So now I'm placing 2 fingers. If you like, you can use 3. I usually like using 2. Place it on the radial artery and count the pulse for complete 1 minute. Some assessor will be counting in the other hand, so please don't be anxious. Count your pulse for complete 1 minute. Let's get started. All right, so Mrs. Ailey, I actually counted your pulse for complete 1 minute and I did your respiration for 1 minute. I didn't want to let you know so it doesn't obstruct the radius. Is that all right, darling?
That's fine.
So I'm just going to chart the pulse. I got 82 as the pulse. 82 falls under here, 82 as the pulse. And the respiration, I got 20. So I'm going here for the respiration, 20. Perfect. So Mrs. Ailey, can I just check your ears just to be sure there is no, there's no discharge? I can see your ears, there is no discharge, and I'm happy to take your temperature with the tympanic thermometer. Is that all right?
That's fine.
This is a salient point I want you to take note of. It is very vital. Take note of this. Now, when using this on your exam, this is where you press. Make sure it bleeds. Please, nurses, make sure it bleeds. I'm not going to say more than that. Just make sure it bleeds. All right, ladies and nurses. Bless you. So what you do is, this is this. Attach it. It's attached now. Come closer, my darling son. Take it directly to the person's ear. You see what I'm doing now is in her ear. And this is where you press, like I said earlier. Did you hear that sound? Please make sure you hear the sound on the exam day. And after you take the temperature, you press here to take this. So I'm going to be putting this in the clinical waist. All right, I'm doing this again for emphasis. This is it. Attach it. It's attached. Take it to the candidate's ear and press this button. So endeavor to hear that sound. Our temperature is 36.7. I put this in the clinical waist. 36.7, and it falls on the ear. So I'm just going to be totaling my news. The patient is on air. Please remember to put this and use scale 1 because the patient is not obviously on oxygen. The patient is on air. So, and the patient is alert because she's been talking with me. So this patient obviously is having a news of what? Of 0. Turn to the back. There's nothing like cramming in this exam. News of 0 is what? 12 hourly. Monitoring frequency 12 hourly. Would you escalate news of 0? The answer is no. So escalation of care? No. Initials VO. Hello, my lovely lady. Hi. So you are having a news of 0. And news of 0 means we are going to continue our routine news monitoring. Of course, there's no cause of alarm. Everything looks stable. And like you said, you feel better, don't you? All right. So I'm very happy with your new score, okay? So can I just, give me a minute. I'll just take off your apron. And it goes directly into the clinical ward, into the clinical waist. Do your hand hygiene. All right, darling. So can I just ask you some few questions? Is that all right?
That's fine.
Do you comply with your medications, darling?
Wow, that's very difficult now.
I understand, but I just want to emphasize it's really important for us to take our medications because when we take our medications, we get better. You know what I mean? Yeah. So if you take your medications more frequently, it's going to minimize how frequently you come to the hospital as well. I know it's not easy, but I just want to encourage you. Do you smoke, my darling?
Yeah.
So how many cigarettes do you smoke, darling?
Because 10 sticks a day.
Oh, bless you, bless you. You know, because you are asthmatic, smoking is very dangerous to someone who is asthmatic, if you know what I mean. But well, it's your choice. When you're ready to stop, is it all right if we refer you to the smoking cessation thing? Is that too much to ask?
I'm ready to stop.
Oh, that's so sweet. You're ready, so that's good. We're happy to refer you to the smoking cessation. And I just want to encourage you. You're doing well. I'm happy with you, but I just want to say to you, can you take more fruits, vegetables, drink enough water, keep up with your appointments in the hospital when you have them, and take your medications regularly. Is that okay?
Yeah.
So how do you get along with your activities of daily living?
Well, when I was very ill, my mom came to stay with me.
Oh, bless her.
But now I'm better, so...
So you stay alone?
Yeah.
Oh, so you stay alone. How is your elimination pattern? Is it okay?
Well, it's been normal.
It's been normal. Well, yeah. That's good. If your elimination pattern is normal, that's good. Is there any concern you have for me?
At the moment, no.
Okay, that's good to know. So guys, after doing your observation, as you are going back to the patient, remember in your planning, you have to say things you had educated the patient on. It's education you gave to the patient. So the next thing after your observation is to go back to the patient. Do you comply with your medication? And of course, you know a lot of people don't comply with their medication. You use that as a medium to tell the patient, you know, comply with your medication. You've given medication advice. Yeah? And the next thing, eat enough fruits and vegetable. You've given adequate diet for your planning. And the next thing, do you smoke? I'll refer you to the smoking cessation team. You know what I mean? And so that's how you get it. How is your elimination pattern? So you just ask the questions, and when your time goes off, you're sure you've done the what? You've done the right thing. And it's same for every other station, including your what? Including your GCS. Is same for every other station, including your MOS. If it were to be your MOS, the first thing you ask, you just go ahead. Oh, sorry, I'll just be starting with your MOS assessment. Your BMI, I can see you have, it's just so easy, guys. I'm going to stop here for today. If you have any question at all, feel free to let us know the question you have, but this is how the exam is in the real clinical setting. Chat well, check your chat, and make sure it is very, very correct. So I really want to appreciate Mrs. Agatha. Mrs. Agatha has been a source of inspiration to me. I met her through my numerous YouTube videos. She said to me, I saw your video, can I meet with you? Where do you stay? And funny enough, we stayed in the same location, and that's how we turned friends. And she's always volunteered herself whenever I'm doing a video. So Mrs. Agatha, I really appreciate you. Thanks for keeping up, for wanting to know this Violet that does YouTube video, and for becoming more than a friend and a family to me. I truly appreciate you for your time. Even when I've not done video, she keep calling me, when are we gonna do a video? So Mrs. Agatha, I'm very grateful. Bless you.
You're welcome.
For all my subscribers that keeps calling me, when are we going to do a video? Guys, I really appreciate you. And this my darling son Tolu has been so helpful. Tolu is the one videoing this. Tolu, God bless you. Tolu, when you call one, tell we answer you. Thank you so much for being there for me, son. I really appreciate. Bless you. And I'll get you a lot of meal. I can promise you that for free. So guys, thank you so much. Share this video with your friends preparing for Osce exam. Remember to give this video a like, and I will see you in my next video next week on cardiopulmonary resuscitation. And until then, keep passing your Osce exam. Bye guys.
Bye.